doesn't mean anything's wrong. It's just going to be a thorough assessment. It's going to be a lot of touching and listening to the upper and lower extremities. Okay? Do I have your permission to proceed?
Yes.
Great. Okay, so first I want to inspect. You can extend your arms out for me. Great. I'm just going to inspect your arms, making sure that they are symmetrical, which they are. I'm looking for to make sure your hair on your arms are evenly distributed, which they are. Now I'm going to fit. This is going to be part of the feeling, which is palpating, okay? All I'm doing now is checking the temperature of your skin, and it's warm and dry to the touch, which is perfect. Now I'm going to check your turgor elasticity in your hands. All I'm doing is I'm going to pinch the top of your hand like this, and we're going to make sure it bounces back, which is perfect, okay? Perfect. Now I'm going to check the capillary refills, which is checking your circulation. I'm going to pinch your nail. Great. Your capillary refills need to be less than 3 seconds, which they are. Perfect, perfect. Now I'm going to check your pulses if I can get you to turn on. Perfect. So what I'm going to do, I'm going to palpate your radial pulses. Perfect. Even and strong, about that ready. And now your radial. Perfect. I'm sorry. Your brachial. I'm so sorry. Perfect. Even and strong, about that ready. Okay, last, I need you to turn your head this way. I'm going to have you grip my fingers. Okay? Even and strong grip. Perfect. Back in. Now I'm going to inspect your neck area. Okay? I'm looking to see for any lumps, bumps, bruises, or pulsations. Not noted. Okay, now I'm going to palpate your carotid artery on your neck in 3 spots. Okay? Using 2 fingers. Okay. Now, this is a stethoscope. I'm pretty sure you've seen these before. I'm going to use the bell side, okay? And I'm going to auscultate your carotid, okay? Which means I'm just going to listen, okay? Okay, so when I do this, what I need you to do is take in a deep breath, and then you're going to exhale, and then I need you to hold it. Okay? All right, taking a deep breath, exhale, and hold it. Okay, breathe. Just breathe normally. How are you feeling? Okay, not dizzy or anything? All right, so I'm going to do your right side, your carotid. And we're going to do the same thing, okay? You're going to take in a deep breath, and you can exhale and hold it. All right, you ready? Yes. Okay, deep breath in, exhale, and hold. All right, breathe. Great, great. Now, we're going to move on and auscultate areas of the heart, okay? And at this time, I'm also going to educate you on the different locations of the valves, the areas of the heart, okay? Okay. Any questions so far? Okay, great. You're doing great. Now, I'm going to use the diaphragm side, which is the large side of the stethoscope first, and then I will use the bell side, which is the small side of the stethoscope, okay? All right. Great. All right. So, we're going to start with their aortic area, which is the second intercostal space on the right sternal border. Then we're going to do the pulmonic area, which is the second intercostal space on the left sternal border. Then we're going to go down to the Erb's point, which is the third intercostal space on the left sternal border. Then we're going to go to the tricuspid, which is the fourth intercostal space on the left sternal border. And then we're going to go to your mitral area, which is the fifth intercostal space on the left mid-clavicular line. Okay? Okay, great. Now, with the bell side, okay? We have your aortic, pulmonic, Erb's point, tricuspid, mitral. Okay? You feel okay?
Yes.
Okay. Now I'm going to get you to lie on your back for me. Got it? Good. Great. Okay, so we're going to inspect. Doing great. We're going to inspect your jugular distension, which is your internal jugular veins, okay? Okay, so can I get you to turn your head to the left? Okay, no jugular distension over there. And then to the right, no distension noted. Okay, great. Now I'm going to palpate or inspect your precordium area, which is the chest wall that's covering your heart area and lower chest, okay? And all I'm looking for is any lumps, bumps, or bruises or pulsations. I don't see any noted, okay? Okay, great. So now I'm going to palpate those same areas around your heart, okay? All right. And we'll use 2 fingers. Okay. Aortic, pulmonic, Erb's point, tricuspid, and your mitral, which is also where your apical pulse is located. Okay? Okay. Now, once again, I'm going to auscultate, which is listening, with the diaphragm and the bell. Okay? Starting with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral, which is also your the mitral. Now I'm going to use the bell side. We have your aortic, pulmonic, Erb's point, tricuspid, and your mitral. Now, if I could get you to turn to your left lateral side, perfect. I'm going to take the mitral valve this way, which is your apical pulse, and I'm going to use diaphragm side, okay? And then I'm also going to use the bell side, okay? Turn a little bit more for me. This is for your mitral valve, okay? Now I'm going to use the bell side. Great. Okay, now we're going to move to your lower extremities, okay? First I'm going to inspect, but I'm going to move this chair because you're a little high, you're tall here, okay? So I'm going to put this chair here for you. How's that? You comfortable? Okay. So first, I'm going to inspect your legs. They are symmetrical. The hair on your legs is nice and evenly distributed. And then no varicose veins present, which is great. Now I'm going to palpate your legs, okay? First I'm checking the temp of your skin. Okay, it is warm and dry to the touch. Now I'm going to check for any edema, which is swelling. Okay, none noted. No edema. to palpate your pulses in your lower extremities, okay? All right, so we have your femoral pulse, which is the growing area, the creases in the growing area, okay? And then we have your popliteal pulses, which is behind your knees. Good. Everything's even and strong bilaterally. Now we're going to go to your posterior tibial, which is located behind and slightly under your malleus of your ankle. Nice and strong. And now we have your dorsalis pedis, which is on the top of your foot. And they are nice, even, and strong. Okay? Can I have your hand? Okay, I'm going to help you sit up. And that concludes your assessment. Any questions? You did great, sir. Thank you so much. This is a verbal report on cardiac and peripheral vascular assessment on an 18-year-old male. We started with inspecting his upper extremities. His arms were symmetrical bilaterally. The hair was evenly distributed. We palpated his skin. It was warm and dry to touch. His skin turgor was elasticity noted. His capillary refills was less than 3 seconds bilaterally. His grip was equal and strong bilaterally. We pulsated his radial and brachial pulses. They were equal and strong bilaterally. Then we moved and inspected his neck. No lumps, bumps, bruises, or pulsations noted. We then palpated his carotid arteries one at a time. No bruits noted. We then listened with the bell of the stethoscope to his carotid arteries one at a time. No bruits noted. We then inspected the precordium. No lumps, bumps, bruises, or pulsations noted. We then auscultated his heart with the diaphragm and bell of the stethoscope. In the sitting and lying position, S1 and S2 noted. We then inspected his jugular veins. No jugular distension noted. We then palpated around his heart area. No lumps, no tenderness, no pulsations noted. We then palpated and listened with the diaphragm and bell of the stethoscope to the mitral valve, which is also the apical pulse, which is located in the 5th intercostal space on the left mid-clavicular line, and we also did it while he was lying in the left lateral to the mitral valve, which is located in the 5th intercostal space in the left mid-clavicular line. We then inspected the lower extremities. His legs were symmetrical. The hair was evenly distributed bilaterally. No varicose veins present. We then palpated, and his skin was warm and dry to touch bilaterally, no edema noted bilaterally. We then palpated the femoral, popliteal, posterior tibial, and dorsalis pedis pulses, and they were equal and strong bilaterally.